Hello and welcome. My name is Calliope and I will be your metaphysical physician today. How are you doing today? I see. Well, I hope by the time you leave this appointment, you feel even just the littlest bit better. Now, as I understand it, you have not been to a metaphysical physician before. Is that correct? I see. So let me tell you a little bit about what I do. Now, if one were to go to their normal PCP, physician, what have you, you would often tell your medical professional about any symptoms you're experiencing. They might do a little bit of poking around, and you may or may not receive some sort of treatment that possibly could have some efficacy, possibly not. Now, my job is to fill in that gap between maybe not having so much efficacy, and what I do helps strengthen that. So these are complementary therapies, not to be used on their own, and they don't treat on their own, but they help to support you. And what I aim to do is I am going to be doing a little bit of poking around of my own, and we'll see what maybe resonates with your energy. Now, there's a couple ways that we can do this. I can either do a full comprehensive sort of overlook. This is going to be quite detailed. There's a lot of things that we can look at and a lot of things we can do. And then after that, we can kind of discuss some maybe possible routes we can take. Or I can do a shorter examination, kind of narrow down a little bit about where you might need some support. And then we can try out a few different therapies right now. It's completely up to you. Absolutely, and we can certainly do the more comprehensive review at a later time. So it's almost a bit of a taste test, a little bit. So let me grab a tool here. This is the only tool that I'll need for this besides my hands. And I would like to conduct a tongue diagnosis. This is used in traditional Chinese medicine. And I'd like to just look at the color, the quality of the skin, the presence or absence of scalloped edges, if there's a coating, all of these different little details that might tell me a little bit about what's going on with you. So from this point forward, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. Thank you. Now, if you wouldn't mind just opening your mouth. Okay. And I'm just going to put the depressor here so that I can get a little look around. And it's not so much that I need to keep the tongue down. It's just more that I'm using it so that, for example, I can get a good look at the side and the other side right here. Good. And maybe just a bit in the back. Okay, and would you mind lifting your tongue to the roof of your mouth. Yes, and I'm just going to hold it up a little. Good. Okay, so you've certainly got a bit of a paleness to that, and some scalloped edges here. So that's good to note. Now, another form of diagnosis in traditional Chinese medicine is we have the pulse diagnosis. And the pulse diagnosis uses 3 different positions, 3 different depths, and I'm looking at quite a few different qualities that the pulse may possess. So if you don't have any preference, no? Okay. So I will just lay my fingers, 3 of my fingers, along the radial artery here. Good, and we're just going to palpate the pulse a little. It's a little bit almost like a guitar string being plucked. And it's a little thin. And a little sluggish, I would say. There's a sluggish quality to it. So a lot of these are pointing to something I see very often, which is a deficiency of qi or life force, energy, what have you. So now I'd like to conduct a bit of an aura reading, but it's more that I'm going to be reading it tactilely. So I'm just going to be kind of feeling around, looking for any little bumps or dips, even holes. Those are kind of rare, but can still happen. So I'm just going to come around here and just do a little bit of palpation along the aura. Now, was there any particular reason that you came to see me? Was there something you were seeking answers about, or wanted perhaps some support with? Absolutely, yes, that is certainly something we can work with. And are you being seen by a physician, a PCP, any sort of specialist? Good, good. So we will have to keep each other in the loop there. We want to support and not overtake or step on anybody's toes. So what I am feeling here is also a bit of a thinness in the aura. It is quite, it's almost like a bit of cling wrap. It's quite clingy to the physical form. It's not breezy, if you will. Now, lastly, I would like to look at your hands. And the hands can reveal a lot about a person. So I just want to see just one of the hands. We can go right here since we use the other one for the pulse diagnosis. And I'd like to look at the quality of the skin, of the nails, and I do just a touch of palmistry, just a general look at the heart, head, lifelines. The fate line, perhaps it doesn't have necessarily a lot of relevance in this particular scenario, but the head, heart, and lifelines do. And I do see some breaking in the lifeline, which may indicate that it is supporting what's going on with you right now. As that's about the age that I would expect. Good. Nice deep heart line though. Very prominent. Quite strong. And I'm just going to touch around the joints. Is any of this painful at all? No. Okay. And if I squeeze the hand? No. Good. So joints are in good health. So overall, how would you state your health would be? How would you describe it? I see. Now, besides what you had sought counsel for treatment, is there anything else you want to focus on? Perhaps in the future, or maybe if there's something you wish to focus on other than this, what might that be? That is a good goal to have. So we can absolutely do that. And that might even be a concurrent goal to what we're doing as well. So I can certainly see that we could get the benefits for both, really. Now, I think with what we have going on, which feels just like quite a bit of stress and fatigue, there is a lot weighing on your shoulders. I would like to give you almost a sort of a miniature world tour of a few therapies that we do offer, if that interests you. Okay, so I would love to start with an Ayurvedic practice called brow pinching. Now that sounds a little strange, but it's more this kind of pinching where there's not a lot of force behind it. It's just a bit of stimulation almost. So I would love to start right in here if you don't mind. Very good. So while the practice is called brow pinching, we will certainly be getting some massage in here. We'll stimulate some marma points. And this is good for lymphatic drainage as well. There are quite a few benefits here. It's great for headaches. There's a lot of tension in this area that we don't focus on. There. And if at any point you wish to have a little bit more or a little bit less pressure, do let me know. And none of this should be painful, so if it is, again, let me know. Some light passes here. And do a few figure 8 motions along the eyes. just to warm up the area a bit. It can be kind of a stimulating massage. We want to make sure we're working some relaxation in there as well. Has quite a bit of movement in it. There. Good. And let's do some pressure here. Press, release, press, release, press, release. Now, these treatments are not going to be the full experience, of course. They're just going to be, as we mentioned before, a taste test, kind of a sample platter. But all of these can certainly be extended into full treatments. And all of these we offer as well, or we can direct you to someone who does do this. We have quite a catalog of different modalities that we can offer to a patient. Good. It's firm pressures. Good. Let's come in here. So I'm just going to be quite gentle. Want to alternate our more firm or stimulating movements with something a little calmer. Now, oftentimes, this is something that can be done in about 10 minutes, but it can be extended much longer. These little kneading movements working down and pushing towards the pre-auricular lymph node. There, we can just smooth that down. Smooth. Good. Good. Just pinch, 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 all around the brow to the very edges. Pinch, pinch, pinch. Good. Now for the next treatment, I am going to have you lie back on the table, if you wouldn't mind. We'll get you all situated, and we can continue with our treatments. Is this a comfortable position for you? And how is the blanket? It's a very luxuriously buttery, soft fleece with a Sherpa lining underneath. It's quite cozy for these quite chilly autumnal nights. Now I would like to continue with a treatment from the Maya. So this is a Mayan massage with Arvigo Techniques. And we're going to start by coming right here. And I'm just going to be stroking upwards. And we'll do 3 strokes in the middle. Come to the side and stroke upwards. And if you happen to recall these movements, you certainly can also do this on yourself. And then we come right back to the middle. And this is moving the skin. We're getting into the skin and pulling up. There's a little bit of a sort of ripple effect. And just moving in this sort of J form here. Just picking up a bit of the skin, bringing it up and around. Good. And how is this pressure? It is quite firm, so don't be afraid to let me know if it's too much. But this modality of massage is more to be therapeutic as opposed to relaxing. And then we'll do a little bit of finger tapping up the sides of the body, a little bit of brisk tapping. And then we can do this at the top as well, where we come in and knead downwards. And bring it in the side. Good. The side of the rib cage down and down, down, down. Good. While this is meant to be more therapeutic, it does tend to be quite relaxing as well. Good. And then we're going to do some zigzag movements. So the touch is going to be light, and with each zag, we get a little deeper. And then when we come back, we grow more gentle until we're just barely touching the skin. And one more, increasing the pressure with each pass. And decreasing. Good. And then we're going to come in here and we're going to have some circular kneading in here. Quite a wide circle. Is this all right? Okay. Pressing in pretty good there, so I just wanted to make sure. Good. And one last pass around these wide kneading circles. And then we start in the middle, and we're going to use just the one hand to go in this spiral. We're going to keep going into the spiral until it's as far as we can go. And then bringing it back to the middle. And then here, just do a bit of holding for a moment. Normally this would last quite a bit longer, but our next treatment does involve quite a bit of holding, so we'll come back to this. Good. Now finally I'd like to conclude with a treatment known as Seva Acupressure. And this is an American modality, and Seva is a Sanskrit word for compassionate service. This particular treatment was designed for first responders for 9/11, and it is since used often in medical settings by medical professionals to help soothe and give support to patients in a hospital. Now, Seva has a specific protocol, and to start with, I'm just going to put my hands on top of your feet here. Now with Seva, we are always trying to keep 2 points of contact because the energy flows between those 2 points. So this can either begin with a leg stretch, or here we're just going to rest the hands on the feet. before we move on to the top of the ankles, and with a full Seva treatment, this can last really as long as you'd like it to, but oftentimes it's about 10 to 15 minutes. And then I'm going to come up and I'm going to lift up the blanket a bit so we can come underneath, and I can hold 2 points on the middle of your back. And I'm meeting your energy where it is. I don't want to press too deep or too softly. It's almost like touching the outside of a bubble. You touch too hard, it'll pop, but there's a sweet spot where you can just glide your fingertips over it and it retains its shape. And then we come down to put the fingers behind the knees here. There we go. Now, since this is a miniature treatment, we're not going for the full minute for each position, but just a little bit to give you a little sampling of what Seva is like. And then we're going to come in at the top of the shoulders here. And my thumbs are going to be pressed in. This is in the sort of supraclavicular fossa area. And I'm just going to press in for a few moments. And then I'm going to squeeze the arms. So we'll start at the shoulders and come down the arm. And at the elbow, we're just going to hold for a moment before we come down to the wrist. Come down to the fingers, and then we'll hold here for a moment. Good. And then we're going to slide up and come right to the top of the back, right behind the neck here. Just holding right in here. You might feel your breathing really deep and really slow down. Good. And then from here we work up the head and sweep across the brow. Come forward here and up the head. And sweep across the brow. And one more time. Up to the head. Sweep across the brow. Good. And then let's work right at the middle of the clavicle here, right on that bone. Just hold here for a moment. And then I'll be working one side and the other. So we have a point at the base under the arms here. and the base of the pinky right in here, the hypothenar muscles, right at that top head of the ulna. So we'll hold here for a few moments. And the other side, base of the underarm and base of the littlest finger. Then I'm going to be putting one hand underneath your back, behind your heart, and one hand on top of the heart. And between my two hands, I can feel your heart beating away. It's a lot slower than it was. There's a lot more ease to it. Quite a bit more calmness to it. Feels like it's unwound a little bit. And then we put the hands below the rib cage here. This is a bit of an interesting hold. It's not often that we have our hands below the rib cage, unless maybe we get a cramp or the hiccups. Good. Good, and then we'll come down to the knees. I'm just going to wrap my hands around the knees down here. There are a few different points that I can get with each of my fingers. Good. Just allow the tissues to soften and the body to relax. And then let's go behind the knees like we had done before. Some of these points repeat. This is one of them. Good, and then we can hold the toes here. Hold the toes. And in a full treatment, you might get each individual toe squeezed at each joint. That one's quite a treat. And then we'll come back up to the top of your back. Hold for a moment. And then we bring the hands up and across the brow. Press in. Come up. Press in. And come up. Good. And then I'm going to put one hand on the tailbone, and one hand is going to come right around your crown chakra. So I'm going to place this hand right at the base of your spine, and this hand will come up right around the crown. Feeling the energy between the 2 points here. Just hovering here. And then lastly, we're going to finish with just holding on to the feet like we had done at the very beginning. We'll just remain here for a few moments. At your leisure, I'd like you to come back up to sitting and we can have a little chat for a moment before we end the session. And that will conclude our treatments today. How are you feeling? Is it at least a little bit better than when you first came in? Good. That's at the very least what we aim to do. Now, if you would like, we can at a later date do a more comprehensive sort of examination. And then we can talk a little more in depth about the different kinds of treatments that we might offer you from all over the world, from right in your backyard, whatever may interest you. Does that sound agreeable? Wonderful. So, I'd like to thank you so much for coming to me to receive this examination and mini treatment session. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of